Thank you, Bruce. And you're way too modest because I learn from you every chance we get. And I think having that, it's been an important and interesting journey for myself as someone who is not only a scholar, but also as a board member on the California Endowment, to think about health in a much broader and deeper way than I used to think about it. And I think it's still part of this kind of common sense notion that most Americans have, which is a fairly narrow reading on what health is and what healthy outcomes are. But still, a lot of progress has been made by many organizations and scholars, and much more to come. So now I'd like to invite all of the panelists that are part of the measurement session to turn on their cameras. And the bios are in the information packet, so we're not going to spend any time at all talking about the distinguished records of each of these folks. So first, we're going to have a set of remarks from Don Hunter, and then followed by John Gastel, and then David Gresky. So each will have some materials to share as they make their opening remarks. But while they make their opening remarks, one of the questions that we flagged during our prep session is to lift up what your personal or professional interest or civic commitment is in terms of what is the big problem that we're talking about here? What keeps you up at night? Why is this work important? And use that as a segue to talk about your work. So first, we'll hear from Don Hunter.